Why do some cancers have systemic treatments before they're stage 4? So if you've completely removed the tumor and those patients have no evidence of disease, but they still end up on a treatment to lower the chance of it coming back, and other cancers don't. Before I was diagnosed with a stage 4 cancer myself, I didn't understand this concept. I figured others may not as well, so what a perfect time to talk about it. Because I was at a conference last week, GU ASCO, where there was new trial data that was presented that might change this in kidney cancer, for clear cell kidney cancer, and very specifically in intermediate and high risk disease patients. I personally think that this is a great thing for patients to learn and understand so that they can better have conversations about treatment with their physicians. So let's talk about what this looks like. So in other types of cancer, let's say breast cancer, for example, you might do a surgery that gets rid of all the cancer, and sometimes they might even do some radiation. And then those patients might go on a treatment to lower the risk of it coming back. But in other cancers, such as kidney cancer, they'd often just remove the tumor, and then those patients wouldn't go on treatment unless it came back. So you can think of like chemotherapy, immunotherapy, TKIs, that kind of thing. So they wouldn't take those things unless it came back. But there was new data that was presented at GU ASCO that might change that. So basically, this trial was looking at patients with clear cell kidney cancer. This is super important. Clear cell specifically, and intermediate and high risk disease patients. Those are the patients that were most likely to have the cancer come back. Important, not a guarantee. I will show you a chart in a minute that shows you kind of the risk there. But basically, they tried Pembro, which is an immunotherapy, against a placebo to see if it would improve overall survival or reduce the risk of death in those patients. And for the first time in kidney cancer, specifically clear cell kidney cancer, this did happen. So for these specific patients, that's stage 2, grade 4, stage 3, or node positive, M1, which is metastases, so spread, but those patients are NED, so no evidence of disease. So that is an example of, say it had spread to the lung with a really small nodule and they took out that spot in the lung and those patients were no evidence of disease afterwards. They also fell into this category where those patients received Pembro for a year or they received a placebo, and it was comparing to see if that treatment helped improve overall survival or reduce the risk of death, which it did by 38%. That was big news, and that is a win for clear cell kidney cancer in that very specific intention to treat population. That part is absolutely crucial. This chart is also important to look at and understand. So you can see these are the patients that these patients had kidney cancer. They removed all of the cancer, and these patients were no evidence of disease when they started treatment. And so you can see here that there's still quite a large number of them that never reoccurred at all. So this is the placebo group right here. And so the disease never came back in those patients. You can see that gap there is larger in the patients that received Pembro. That's an immunotherapy. So you can see they had a longer overall survival. And the gap between those, that's kind of where that 38% came from. But it's really important to look at this whole chart so that you can get context for that. Because these are really important things to know and understand. So when you're having this discussion with your physician, you can talk to them and find out if the benefits outweigh the risks for you to take the treatment. For example, Pembro is an immunotherapy. And so there are side effects that happen when you take any type of systemic treatment. And some side effects for immunotherapy can be lifelong. So it's a really great option to be able to have for this specific population of patients. But it also means those are really important conversations for a patient and a physician to have to decide if it's worth it for them specifically, because some patients may never need it. And that is where a very crucial piece of information comes in, is because when you look at this study, this was for clear cell kidney cancer. And again, specifically for these patients that fit into this category here. Now, this is super important because I know when I was initially diagnosed, I would hear people were on a specific treatment and I thought like, okay, if they were on that treatment, shouldn't that work for me too? That was before I knew how drastically different types of cancer are, even different types of kidney cancer. So clear cell kidney cancer, for example, is very different than many of the non-clear cell kidney cancers, such as chromophobe kidney cancer. In stage 4 patients, many patients with clear cell kidney cancer can respond to immunotherapy, for example, like the one that was prescribed in this trial. But this trial was actually in an adjuvant setting, so this was before patients had reoccurred. That's what adjuvant means, so after surgery and before those patients have spread or show that the disease has come back at all. That is treatment in the adjuvant setting. But treatment in the metastatic setting for clear cell renal cell carcinoma has historically used immunotherapy for several years now, and it can work well for those patients. However, the current immunotherapies don't typically work very well for chromophobe kidney cancer. And so this is really important information and context, because you can't take a treatment that is in the adjuvant setting for clear cell renal cell carcinoma that was based on these types of patients and say, maybe let's give this to a patient with chromophobe kidney cancer and they'll likely have the same response, because they might not and probably won't. There hasn't been a trial run for chromophobe kidney cancer with this. But for example, at this very same conference where they were presenting the data that Pembro is good for clear cell kidney cancer in the adjuvant setting, and again, that's a very specific population of patients, there also was this presentation that talked about avoid adjuvant Pembro in non-clear cell RCC, please. And that is because these trials have not been run in non-clear cell kidney cancer. And some of these non-clear cell kidney cancers don't typically respond to things like immunotherapy. Chromophobe kidney cancer is one of them. So you can't just take a treatment and copy paste, because for example, when we look at the other chart that we just looked at, remember this group of patients here that the cancer never came back in, you are then prescribing treatments to those patients that may not have ever had the disease come back. And for other types of kidney cancer, so for chromophobe kidney cancer, it only spreads about 5 to 10% of the time. So if you look at this chart, that line would be clear up here. And so you can imagine in those patients, you might be doing more harm with the side effects that come from that treatment, as they may not improve the survival. Again, there hasn't been a trial to look at that. So these trial results were a very big win for this group of patients here, but super important for patients who don't have clear cell kidney cancer to know about, as this might not directly apply to them. And these are really important conversations to have with your physician to make sure you understand the treatments that are prescribed to you and how much benefit you may or may not receive from them. Definitely not medical advice in any way, shape, or form. Those decisions and conversations should always happen with your doctor. But hopefully this info can add some context to those conversations so that you can have them with your providers. Knowledge is power, and it's super important to be informed. This was a really long video, but these are super important topics. So let me know if this was helpful at all, and I will try to make more videos like this in the future.